Picture this: two patients, same diagnosis, colon cancer, stage 2, one in Manchester, one in Miami. The Manchester patient walks into their GP surgery. No payment. Gets referred to an oncologist. No payment. Receives chemotherapy, surgery, and follow-up care. No payment. Total out-of-pocket cost, $0. The Miami patient? Different story. They check their insurance network, confirm their oncologist is in network, pay a $50 copay for the consultation, receive treatment with a $6,000 deductible, then 20% co-insurance on everything after that. Total cancer treatment cost, $150,000. Their share, $35,000, plus premiums of $7,000 per year. Here's what makes this staggering. Medical bankruptcy effectively doesn't exist in the UK. In the United States, medical bills are the leading cause of personal bankruptcy, affecting over 500,000 families every year. Two wealthy nations, two radically different healthcare philosophies, and billions upon billions in human cost that goes far beyond what appears on any balance sheet. Today, we're dissecting the true price of healthcare. Not just what governments spend or what insurance companies charge, but what it actually costs human beings to get sick. We'll examine why Americans spend more than twice what Britons spend per person on healthcare, yet live shorter lives. We'll expose the hidden costs: administrative bloat, denied claims, medical debt, and the fear that keeps people from seeing doctors until it's too late. And we'll ask the uncomfortable question: is the American model of private insurance fundamentally broken? Or is the NHS simply unaffordable propaganda? The data tells a story politicians won't. Let's find it. Let's start with the raw numbers, because they're astonishing. In 2024, the United States spent approximately $4.9 trillion on healthcare. That's $14,570 per person. The UK spent roughly $393 billion, about $5,800 per person. Americans spend 2.5 times more per capita than Britons on healthcare. But here's what should stop you. Despite spending vastly more, Americans don't live longer. US life expectancy is 78.9 years. UK life expectancy is 81.3 years. Americans spend 150% more money to live 2.4 years less. So where does all that American money go? Administrative costs, the invisible tax. The U.S. healthcare system spends an estimated $1 trillion annually on administration. That's roughly 20 to 25% of total healthcare spending. Insurance companies employ armies of people to determine what they will and won't cover. Hospitals employ armies of people to bill insurance companies. Doctors' offices employ full-time staff just to navigate insurance paperwork. The NHS, administrative costs are roughly 2% of spending. Let that sink in. America spends 1/4 of its healthcare budget on bureaucracy. Britain spends 1/50. A 2020 study in the Annals of Internal Medicine found that U.S. physicians spend nearly $100,000 per year per doctor on billing and insurance-related activities. That's twice what Canadian physicians spend, and Canada also has private insurance, just with a single-payer public option. Insurance company profits. In 2024, the 5 largest U.S. health insurance companies, United Health Group, Elevance Health, Cigna, CVS, Aetna, and Humana, reported combined revenues exceeding $1 trillion. United Health Group alone posted $100 billion in revenue, with $22 billion in profit. These are not healthcare providers. They're middlemen. They don't treat patients, perform surgeries, or discover cures. They decide who gets covered and collect premiums for doing so. The NHS has no equivalent, It's a direct government service. There's no profit margin because there's no profit motive. Drug prices, the American markup. Pharmaceutical spending tells an even starker story. Americans pay dramatically more for prescription drugs than any other developed nation. A month's supply of insulin in the US can cost $300–700 without insurance. In the UK, prescription charges are capped at $9.90 per item, about $12, and over 89% of prescriptions are dispensed free due to exemptions for chronic conditions, low income, age, or pregnancy. The diabetes drug Ozempic costs roughly $969 per month in the US. In the UK, it's provided by the NHS when clinically indicated at no direct cost to the patient. Why? Because the NHS negotiates drug prices on behalf of 68 million people. It can demand lower prices or refuse to buy. The US system has no such mechanism. Medicare is legally prohibited from negotiating drug prices for most medications, a law written by pharmaceutical industry lobbyists. The result: Americans subsidize drug development for the rest of the world. Pharmaceutical companies charge Americans premium prices and sell the same drugs to other countries at discounts because the US market is too lucrative to abandon. But cost per person only tells part of the story, because in America, not everyone gets health care. As of 2024, approximately 26 million Americans have no health insurance at all. That's 8% of the population, more than the entire population of Australia. Another 23 million are underinsured, meaning their insurance has such high deductibles and co-pays that they avoid care because they can't afford it. So roughly 15% of Americans either have no insurance or have insurance so inadequate they might as well not have it. The employment trap. Here's a crucial detail most people don't think about. 160 million Americans, roughly half the population, get health insurance through their employer. This creates what economists call job lock. If you have a chronic condition, diabetes, cancer, heart disease, you cannot afford to leave your job, even if it's toxic, underpaid, or preventing career advancement. Because losing employer-sponsored insurance means losing access to affordable medication and treatment. This has enormous economic consequences. People stay in jobs they hate because they can't risk losing health care. Entrepreneurs don't start businesses because they can't afford individual insurance. Talent doesn't flow to where it's most valuable. It stays where health benefits are most secure. The NHS severs this connection completely. Healthcare is not tied to employment. You can leave a job, start a business, retire early, or take time off without losing access to medical care. This is economic freedom Americans simply don't have. The denial machine. Even when Americans have insurance, coverage isn't guaranteed. Insurance companies deny roughly 1 in 7 claims, about 15 and 20% depending on the insurer. Why? Because insurance companies make money by collecting premiums and minimizing payouts. Denying claims is profitable. And since most patients don't appeal denials, either because the process is complex or because they can't afford lawyers, insurers save billions. Prior authorization is another barrier. For many procedures and medications, doctors must get insurance company approval before treatment. This adds delays, administrative burden, and another opportunity for denial. Studies show prior authorization causes treatment delays in 94% of cases and leads to patients abandoning treatment in 28% of cases. The NHS doesn't deny medically necessary care because an accountant decided it wasn't cost-effective for the company. If a doctor says you need treatment, you receive it. Waits may be long due to capacity constraints, but you're never denied because someone calculated the claim would hurt quarterly profits. Now let's talk about what this means for actual human beings. Medical debt and bankruptcy. Over 100 million Americans carry medical debt, not because they're irresponsible, because they got sick and their insurance didn't cover everything. Medical debt is the leading cause of personal bankruptcy in the United States. A 2019 study estimated that 66.5% of bankruptcies were tied to medical issues, either because of high medical bills or time lost from work due to illness. This doesn't happen in the UK. Medical bankruptcy is virtually non-existent. The NHS may have long waits and funding problems, but it doesn't bankrupt patients. Delayed care and preventable deaths. Here's where the US system becomes lethal. Studies estimate that 45,000 Americans die each year due to lack of health insurance. These are preventable deaths, people who didn't see doctors because they couldn't afford it, who didn't fill prescriptions because they cost too much, who ignored symptoms until emergency rooms were the only option. A 2020 study in The Lancet estimated that adopting a Medicare for All system could prevent 68,000 deaths annually due to increased access. The NHS isn't perfect. Waits for elective procedures can stretch months, A&E departments are overcrowded, and cancer survival rates lag behind some European neighbors. But people aren't dying because they couldn't afford to see a doctor. Americans with insurance also delay care. A 2022 survey found that 43% of insured Americans delayed or avoided medical care due to cost concerns. Nearly half of insured adults reported difficulty affording healthcare costs. Think about that. People with insurance still can't afford to use it. The mental health burden. There's another cost nobody talks about: the psychological weight of medical debt and insurance fear. Americans live with constant anxiety about healthcare costs. Can I afford this procedure? Will insurance cover it? What if I get sick and lose my job? Medical bills cause more stress than credit card debt or student loans for most Americans. This isn't abstract. Chronic stress contributes to cardiovascular disease, mental health problems, and shortened lifespans. The American healthcare system is literally making people sick through stress about paying for healthcare. UK residents don't carry this burden. Healthcare is a given, not a financial calculation. You get sick, you see a doctor, you get treatment. The NHS may frustrate people with waits and underfunding, but it doesn't terrorize them with bankruptcy. So if Americans spend so much more, surely they get better care, right? Sometimes, but not as often as you'd think. Where America excels. America leads the world in medical innovation. American research institutions produce groundbreaking treatments. Cancer survival rates for those with good insurance and early diagnosis are among the world's best. If you're wealthy and have excellent insurance, American healthcare is world-class. The Mayo Clinic, Johns Hopkins, Massachusetts General Hospital, these are global leaders. Americans pioneered treatments for HIV, developed mRNA vaccines, and pushed the boundaries of surgical techniques. Where America fails. But population-level health outcomes tell a different story. Maternal mortality. The U.S. has the highest maternal death rate among developed nations, 23.8 deaths per 100,000 live births. The UK rate is 10.5. American mothers are more than twice as likely to die in childbirth. Infant mortality. The U.S. rate is 5.4 deaths per 1,000 live births. The UK rate is 3.8. American babies are 42% more likely to die before their first birthday. Life expectancy. As mentioned, Americans live 2.4 years less than Britons despite spending 2.5 times more. Chronic disease. Americans have higher rates of obesity, diabetes, heart disease, and preventable conditions than most developed nations, partly due to diet and lifestyle, but also because preventive care is cost-prohibitive for millions. The harsh reality: American healthcare is optimized for profit, not population health. It delivers exceptional care to those who can afford it, and inadequate care to everyone else. The NHS. Imperfect, but universal. The NHS delivers mediocre care to everyone. That sounds like an insult, but it's actually remarkable. Regardless of income, employment, or health status, every UK resident gets the same access to doctors, hospitals, medications, and treatments. Cancer survival rates in the UK lag behind countries like Germany and Sweden, but not catastrophically. The 5-year survival rate for common cancers in the UK is roughly 72%. In the US, it's about 68–70% when averaged across all patients, including the uninsured. The NHS waiting lists are a legitimate crisis. 7.4 million people waiting for treatment as of late 2025. But waiting is different from being denied. The NHS delays care due to capacity constraints. The US system denies care due to inability to pay. Which is worse? That's a moral question, not a medical one. So why is the American system so expensive? Fragmentation. The US has thousands of insurance companies, each with different networks, rules, and coverage. Every hospital negotiates separate rates with every insurer. Every doctor's office must navigate dozens of billing systems. This fragmentation creates massive inefficiency. The same MRI might cost $500 at one facility and $3,000 at another, depending on negotiated insurance rates, not actual cost. The NHS negotiates once, nationally. One price for an MRI, one price for a surgery, one price for a medication. This eliminates price variation and reduces administrative overhead. Fee-for-service incentives. American doctors and hospitals are paid per procedure. More tests, more scans, more surgeries mean more revenue. This creates an incentive to overtreat, not out of malice, but because the system rewards volume over outcomes. The NHS pays providers salaries or capitated payments, fixed amounts per patient. This removes financial incentives to overtreat, but creates other problems, like underprovision if funding is too tight. Neither system is perfect, but the US model systematically drives up costs through perverse incentives. The middleman economy. Insurance companies add no medical value. They don't make anyone healthier. They extract profit by standing between patients and doctors. Administrative costs consume 25% of US healthcare spending, roughly $1 trillion per year. If America eliminated insurance company overhead and adopted NHS-style administration, it could save $800 billion annually. That's enough to provide universal coverage to every uninsured American and still have money left over. But insurance companies employ hundreds of thousands of people and generate billions in profit. They lobby aggressively to protect their position. They fund think tanks that argue private insurance is more efficient. They donate to politicians who block reform. The result: Americans pay vastly more for health care, while insurance executives collect 8-figure salaries. So what's the verdict? The NHS is underfunded, overburdened, and struggling to meet demand. It's not perfect. It makes mistakes. It frustrates patients with waits and bureaucracy. But it doesn't bankrupt anyone. It doesn't tie healthcare to employment. It doesn't deny claims to protect profits. It doesn't let people die because they couldn't afford insulin. The American system delivers world-class care to the wealthy and leaves everyone else with medical debt, denied claims, and the constant fear of financial ruin from illness. Americans spend 14 $570 per person per year on healthcare. Britons spend $5,800. Americans live shorter lives. They go bankrupt from medical bills. They delay care because they can't afford copays. They stay in bad jobs because they can't lose health insurance. The billions in human cost aren't just financial. They're measured in preventable deaths, untreated chronic conditions, stress-induced illness, and the quiet desperation of choosing between medication and rent. Two systems. Two philosophies. One treats healthcare as a human right. The other treats it as a commodity. The data is clear. The American model costs more, delivers less, and inflicts suffering that no wealthy nation should tolerate. If you found this analysis valuable, let me know in the comments which healthcare system you'd choose if you could design one from scratch. And if this video challenged your assumptions, consider sharing it, because this conversation is one both nations desperately need to have.